How do early swallowing assessments help stroke patients? Imagine waking up after a stroke and suddenly finding it hard to swallow. Early swallowing assessments are like a safety net that catches problems before they become serious. When someone has a stroke, they often develop dysphagia, which means difficulty swallowing. More than half of stroke survivors experience this issue, and if not caught early, it can lead to dangerous complications like aspiration pneumonia. This happens when food or liquids accidentally enter the lungs instead of the stomach, causing lung infections that can be life-threatening. By performing early swallowing assessments, healthcare teams can identify who is at risk for these problems right away. This is important because the sooner dysphagia is detected, the quicker they can act to prevent complications. For example, they might recommend avoiding oral intake temporarily or using a feeding tube to ensure proper nutrition and hydration. This approach helps reduce the chances of developing pneumonia, which is a major cause of illness and death in stroke patients. Early screening also improves overall recovery. When healthcare providers know about swallowing difficulties early, they can tailor care plans specifically for each patient. This might include special diets with thicker liquids that are easier to swallow or exercises to strengthen swallowing muscles. Speech and language therapists often work with patients to teach safe swallowing techniques, which can help them eat and drink more confidently. There are different ways to assess swallowing function. Clinical assessments like the bedside swallowing screening test or the gugging swallowing screen are quick evaluations done at the bedside. These tests involve simple tasks, such as observing how a patient swallows water or other small amounts of food. For more detailed information, instrumental tests like fiber optic endoscopic evaluation or videofluoroscopic studies provide visual images of the swallowing process. These help identify if food or liquids are entering the lungs, so the team can plan the best interventions. In hospital settings, early swallowing assessments are part of the standard protocol for stroke care. They help determine the safest way for patients to eat and drink, reducing the risk of complications. Based on assessment results, patients might be given smaller meals, thicker liquids, or specific swallowing exercises. Multidisciplinary teams including speech therapists, nurses, and dietitians work together to support each patient's unique needs. In summary, early swallowing assessments are a vital part of stroke treatment. They help identify swallowing problems quickly, prevent serious health issues like pneumonia, and support a patient's recovery journey. Always remember, if you or someone you know has had a stroke, it's essential to consult healthcare professionals for personalized care and guidance.